Hi, my name is Peter Leypold and I'm an occupational therapist with Solace Pediatric Home Healthcare. I became an occupational therapist in large part because of my mom. She still works as a teacher assistant for children with autism at the local school. And so as a middle schooler, as a high schooler, I would go there pretty often to help out around the classroom. And the more that I got to know these kids, the more that I realized that I wanted to work with children for a living. And so initially I thought maybe let's be a pediatrician, but over time I realized that what I really wanted was a career where I can form a deeper connection with the families and the children that I treat, and be able to really customize and tailor my treatment plan over time and see the results over a longer period of time. As an occupational therapist, we really run the gamut as far as medical diagnoses and age range. The youngest child that I see is about 2 years old, and then the oldest one that I see just recently turned 16 years old. A lot of what we do depends on the child's diagnosis. A lot of what we do depends on the child's needs around the home, cultural factors, a lot of things. So from a medical standpoint, we see children that have mild developmental delays to children that are on the autism spectrum that require a lot of sensory and adaptive needs to children that are a little bit more medically complex. So there have been lots of great moments as an occupational therapist. The most recent one had to do with a little girl that I just discharged a couple weeks ago. It was a child that I'd been seeing for almost 2 years, so it was pretty bittersweet that she was graduating from occupational therapy. So I have a phone call with her mom and talk about all the progress that she's made from age 4 to age 7. And so when mom talked about that, the thing that really resonated with me was that she talked about how therapy over time changed the relationship that she had with her little girl, simply because at the time that we started, she wasn't communicating with other children effectively, and she wasn't able to draw, color, and really play with other children in a way that she wanted to. And so over time, she developed those skills, and now she's playing on the playground with all of her classmates. She's in 2nd grade right now, and she's just absolutely rocking it with her spelling words. She's able to make arts and crafts projects. She's able to follow long sequences. And so when mom said that it changed the relationship between her and her daughter, that's really what it's all about allowing the child to be the best that they can be and to be able to interact in the environment that they are given the way that they want to interact with it.